Today, we want to bring to your attention a situation that jeopardizes health care for everyone in the Commonwealth. Pennsylvania's access to quality health care is once again in jeopardy. Interestingly enough, not by partisan legislators, but by the state judiciary. The courts are looking to reverse progress that has been made to ensure access for all Pennsylvanians, regardless of zip codes, to quality health care. Their action has the potential to cripple the state's healthcare industry and break the valued bond between a patient and their doctor. If this rule is reversed, the insurance premiums of our doctors, hospitals, clinics, and other providers will skyrocket, just like they did in the early 2000s. Most likely, that will create conditions in which our physicians and specialists leave Pennsylvania, their patients, and their practices. I want to thank our members for joining us, and I know that we also have a senator here, and to the many people and organizations for their advocacy on this issue. We have doctors, nurses, medical school professors, along with the Pennsylvania Coalition for Civil Justice Reform. Their partners, the Pennsylvania Medical Society, the Pennsylvania Chamber of Business and Industry, along with the numerous businesses and healthcare organizations, have already galvanized their members to take a stand, and we say thank you. Today, we will hear from our majority leader, who himself worked in healthcare during the crisis, our speaker, who tirelessly worked on the successful legislation, along with two physicians and a healthcare executive who experienced it firsthand. I think that you will find their stories very compelling. From my perspective, repealing the rule would be especially detrimental to rural areas, just like mine, where I represent Clarion County, part of Armstrong, and part of Forest. While we have good doctors in our Commonwealth and in our communities, attracting physicians and specialists to our rural area is already challenging. Traveling to Pittsburgh, Cleveland, and Philadelphia to find specialists is routine for many patients and their families. In fact, I know a teenager in northern Armstrong who has been bravely fighting a rare form of cancer, and she and her family have basically been commuting to Pittsburgh for more than a year. And she's received even more advanced treatment in Philadelphia, a 6-hour drive from home. That's now. Stories like this are common in our rural Pennsylvania. If doctors cannot afford to practice in Pennsylvania, where will our people go? Where will our constituents go? So many patients and their families cannot make daily or weekly trips out of the area for specialists. I can't even imagine if expectant mothers or patients with critical needs or chronic illnesses would need to visit a family doctor that's hundreds of miles away. I also have significant concerns about the lack of physicians and how that could pose an even greater hardship on new mothers, especially in rural areas where we are already in shortages with OB/GYNs. I also worry that many advances that we have made in medicine may come to a screeching halt if doctors' insurance becomes so expensive there won't be much money left to invest in state-of-the-art equipment or technology.